posterior, okay? So it's a little bit different, so it depends upon which way you're gliding it, but it's going to be a little bit different. So basically your sternum is stable. I really can't glide my sternum. I mean, it's stable there. So you don't have to worry about stabilizing the thorax. It's just, it attaches to the everything else and it's not really going to move, okay? So I'm just going to glide the clavicle then, okay? The distal end of the clavicle. And you know, most of us can see here where this comes across and you can feel that sternal notch, okay? Right there. So I'm just going to be right off that sternal notch, okay? So if you find that sternal notch there, make sure you don't dig into their throat, okay? Okay, you don't want to choke your patient, okay? But then I can also feel clavicle coming across here, and where my fingers meet is basically your SC joint. Does that make sense? Okay, so I don't want to be here. I want to be right here on clavicle. I want to make sure I'm on clavicle and not on sternum. You know, for a guy, you can probably feel down a little bit. A woman, you want to be a little more careful that you're not like, you know, palpating down too far, okay? But you can kind of feel where the sternal border comes, okay? All right. So you can do this mainly supine. It's done. Okay, for a posterior glide, you can do your thumb. Usually thumb's most comfortable. You can also put like a finger kind of over that, you know, like thumb to stabilize it a little bit better. Some people just like really hyperextend their thumbs. You guys want to watch doing this, that your thumb is not like this when you're mobilizing, or guess what, you're going to end up with like a lot of problems. So some people don't have the strength to stabilize, so you know they can keep another thumb against it, okay? So either way, I just tend to do like, because I've got small hands, I tend to do one thumb, you know, on top of another one, okay? So we can glide this in a whole bunch of different directions. If we're doing a posterior glide, we're going to increase retraction, okay? Because the roll and glide are in opposite directions, okay? So you should feel it even springing a little bit underneath your fingers. I don't know, you might be able to feel it spring a little bit.
I know.
Is it posterior glide?
Yeah.
What
This is
kind?
posterior, okay? So I'm gliding straight down into her body, okay? Then I can also go inferior. I would probably come up above the patient's head in this situation, okay, to glide in inferior. Make sure you're not right in their face, okay? I find here, right, that sternal notch. I'm going to go make sure I'm on the clavicle. And I've got two thumbs. I've got usually one thumb over another thumb. And I'm just going to apply straight force that direction toward her feet. Inferior glide, kind of same as if you think about shoulder. So just that direction, okay? So right there. And just inferior. Once again, we have like little foam pads in the clinic that we can use. Some patients can tolerate this and some people are super sensitive. Think about it, there's not a lot of muscle tissue there,